Hi, this is Terry. Welcome back to my channel and welcome back to the continuation of the Midlife Opportunities series. If you missed the first couple episodes, I'll go ahead and put the link up here. And today's topic is all about health. I know for me and a lot of people that I know, especially during the pandemic, we've been putting off our health appointments, our dental appointments, out of concern about getting sick while we are out in the world. Definitely close proximity to our healthcare providers. And I think it's time, I know for me, it's been time to get back and start taking care of my health and making my health a priority. As I talk about in my book, Piloting Your Life, plug is usually what Finn says. Midlife is a perfect opportunity to really take control of our health. Our bodies are changing. Many of us are going through the perimenopause transition, or the menopause transition, which is perimenopause, menopause, and then post-menopause. And a lot of things are changing. Our hormones are changing, and there are some new things that come up during midlife that didn't exist before, and when it's really time for us to take care of our health. Last year, the year before, I was listening to a podcast by Stephanie Sammons, and she is actually a financial planner out of Texas, but she also talks about health and wellness, which I absolutely love, and I'll go ahead and put a link in the description for her podcast because I think it's great. She was the Midlife Money Gal at one point. She suggested creating index cards with your health things so that throughout the year you're making sure that you're taking care of them and you remember to do them. And just recently I did my annual dermatology check back in January. I finally went to the dentist. I have to have periodic retinal checks, and so I had my 6-month appointment, which was 7 months late. And I'm working towards having cataract surgery in my left eye, which I talked about in this video if you're interested. But I think it's a fantastic way to keep track, especially for those of us who are really trying to avoid everything related to healthcare. I don't like going to the doctors, I don't like being sick, and I don't like admitting that I might have some health issues. In my book on page 49, I talk about why making your health a priority in midlife is important. And I say if we don't take good care of ourselves in midlife and fail to manage our symptoms and health during the menopause transition, we can create additional, more tenacious health issues: metabolic disease, heart disease, osteoporosis, and other chronic conditions that can be mitigated or avoided altogether. Enduring in midlife doesn't lead to better mental or physical health. Which I absolutely agree on still after writing this book a year and a half ago. The other thing is that unfortunately our healthcare system really doesn't look at us holistically, not even across our body, but throughout our life, because we really need holistic care across our entire lives rather than at a single point in time. Certain things that may have come up during pregnancy actually are indicators of things that are going to happen later in life, which is why it's even more important for us to really take a good look at our health in midlife. And remember, midlife is between the ages of 40 and 65. So I'm 50 and doing regular blood work and working with my doctor to make sure that I am all good to go. Unfortunately, there's not great data on women going through the menopause transition as to what good numbers are, bad numbers are, since most of the data is really based on men, primarily white men, and not really based on women. So if you're going to work with a health practitioner, make sure that they understand women's bodies and they understand women's bodies going through the menopause transition. So one other thing that I mentioned was we don't have to endure during this time, whether it's pelvic floor related issues, low libido, what else do I have on my list? Hot flashes, anxiety. There are ways that we can take control of our health, as I talk about on page 58. First of all, we have to acknowledge that this is where we are. And then secondly, we need to take a realistic assessment of our lifestyles and our health conditions. We can seek out health providers who are trained to help women in midlife. We can research and better understand our bodies and what options are available. Understanding our health risks is also very helpful. And then the next step is really to make changes that can truly make a difference over time. There's no single pathway for all women, and we need to find what works best for us based on our risk factors, our symptoms, and then put our own plan together in place. And that's what I challenge you to do today, is really acknowledge where you are. Like, I'm going to start seeing a pelvic floor physical therapist to work through some issues. I hope to once again be able to bounce on a trampoline without peeing. That may or may not be possible, but I'm at least exploring that option. And dealing with some other things that I don't want to progress into greater issues. So I challenge you to do the same. And I look forward to hearing about what it is that you're doing and whether something like this index card might be helpful to you as a constant reminder of your various different health checks throughout the year. I'm super lucky that I'm pretty damn healthy, so my list is relatively short. And with that, I just want to say thank you so much for watching. If you haven't subscribed, please do so. And I think that's it. Finn's nodding their head. So as always, let go of perfection, take some risks, and above all else, have some fun.